The implications of high-altitude exploration on the human body. The recent increase in the mortality rate of mountaineers attempting to summit Everest has been shocking. But what has caused this dramatic increase in deaths, and what effects does high altitude have on the human body? Stay tuned as we turn to physiology to explain these horrific current events. Due to a strong westerly jet stream, the Everest climbing season is limited to 4 periods of 4 to 5 days at a time, where the climbing conditions are ideal. This season begins around the 23rd of May and lasts for about a week or so. Climbing at this time is extremely popular. 11 people have died on Mount Everest since the beginning of this climbing season, and this has largely been attributed to 2 main factors: overcrowding and as a result of an influx of inexperienced climbers. Overcrowding on Everest has long been an issue, as the Nepalese government fails to limit the number of climbing permits issued, and they fail to regulate what constitutes a fit individual. This year, the Nepalese government issued permits to 381 people, which is reported to be the highest number ever. More climbers mean that there are more delays as people attempt to summit Everest, as you can see in this image here. Waiting in these conditions is extremely taxing on the body, as at this elevation, there is only 1/3 of the oxygen in each breath, as there would be in a breath at sea level. So anyone can climb Everest. All you need is a doctor's certificate and a permit that'll set you back around $11,000. This lack of regulation on experience and the physical health requirements has resulted in many inexperienced climbers attempting Everest. Not only does this contribute to the overcrowding, but increases the fatality rate as they neglect their limits, are unprepared, and fatigue more so than their experienced peers. While these explain the increase in deaths, what increases the mortality rate at high altitude? What are the physiological effects on the human body that put these mountaineers at risk during their excursion to the summit? The most common illnesses associated with high altitude conditions include acute mountain sickness, high altitude pulmonary edema, and high altitude cerebral edema. These illnesses are coupled with a damaging psychological compulsion to summit a mountain at all costs, known as summit fever. Acute mountain sickness is the most mild, but also the most frequently occurring altitude-related illness, occurring in more than 25% of people who travel above 3,500 meters, and more than 50% of people who travel above 6,000 meters. Symptoms of AMS include nausea, vomiting, fatigue, changes in appetite, and headaches. Mountaineers who present with AMS should avoid further ascent and rest. In severe cases, they may be administered oxygen and given prescription medication. If symptoms do not waver, it is recommended that the climber descend. High altitude pulmonary edema is in most cases preceded by the symptoms of AMS. It occurs in unacclimatized mountaineers, and the risk increases with altitude and with rapid ascent. The physiological implication of high altitude pulmonary edema presents itself in the instance where a deficiency in oxygen causes blood flow to be redirected towards better oxygenated parts of the lung, resulting in hypoxic pulmonary vasoconstriction. This exposes the pulmonary capillaries to high blood pressures that damage them and then leads to the edema. This physiological hypoxic response means that oxygen levels throughout the body are limited, and the right side of the heart is put under extreme pressure. Symptoms include dyspnea, which is difficulty breathing, cyanosis, which is a blue colouring of the skin and lips, and tachycardia, which is increased heart rate. This is all coupled with an increase in body temperature. The most simplistic treatment for HAPE is descent. HAPE is the most common cause of death resulting from exposure to high altitude. High altitude cerebral edema is the most uncommon altitude-related illness and is distinguished by disturbances in consciousness that may result to psychiatric changes of varying degrees. It is often preceded by AMS and/or HAPE. HACE is an encephalopathy disruption of the brain barrier that causes the swelling of the corpus callosum in the brain. Drowsiness appears as one of the first changes in consciousness, and other symptomatic changes are ataxia, which is a loss of movement and a loss of control of the body, anorexia, which is loss of appetite, hallucinations, and in some cases vomiting. In relation to AMS, HAPE, high altitude cerebral edema is the most uncommon, yet causes severe morbidity rates. So this presentation has shown you what causes the physiological changes that result in death at high altitude. Thank you.